Okay, today we're going to talk about is correcting your posture making your back or neck pain worse. It's a question that comes up sometimes. Some people say correcting my posture, but it almost hurts when I make that correction. When I stand up nice and tall, it seems to bother me more. Okay, that can also happen when we use a lower back roll for sitting, which we'll show you, and also when you're lying down lying down to sleep. Sometimes using a neck pillow that's not right for your neck. Or a back pillow for your back. It's got to fit your situation, okay? So someone that's got a loss of motion, we use the neck as a starting example. We have someone that's got a forward neck posture like so. And anytime they try and correct, now this is as far as their neck can move. They're in a slight forward position. They can only go up a little bit. You'll tell this person to make that correction, and they'll try and make that correction, and they brace themselves and stand up nice and tall, and it's almost a strain to them. So to make that correction is not good for that person. For the most optimal posture is the one that's halfway between here and a slightly relaxed posture, okay? This may be good posture for them. Until we regain that motion, we have to regain that motion. So some of the exercise we do here is a cervical retraction or cervical retraction extension. These are two movements. Okay, now this person has the available range of motion. Now they can correct that posture. So now this person can sit up tall and be reasonably comfortable and be more upright and more kind of stacked as far as their, let's say, in regards to their neck. So we have to consider that the person has enough range of motion to attain what we consider perfect posture. A lot of times we talk about, from a side view here, ears at the tip of the shoulder over our hip bones here is kind of good alignment. But we have to have adequate posture. So two other examples of this is using a lumbar roll and also a cervical roll for a night pillow, for a pillow for your night. So sometimes the lumbar roll has to be small enough for the person's range of motion, and also the neck pillow you have to have enough range of motion to the neck to do that. So if you're having a struggle, don't beat yourself up. It may be that you just don't have adequate range of motion for this device. So you may have to adjust it or do a little bit of range of motion exercises before we look at that perfect posture. And realize there's this whole debate right now whether a perfect posture, posture is really connected to pain. So we can't always make that linkage. There are times with neck postures it's related to maybe a loss of motion. There's a big stress component for people that have neck pain. So we have to look at other factors. Posture is part of it in some cases, and in some cases it's not. So let's talk about the use of the lumbar roll. Okay, so another example, posture. We're going to talk about seated posture. This is a lumbar roll here. Okay, if you're struggling with sitting and you're using a lumbar roll and it's actually feeling like it's worse, it might be that you don't have adequate motion in your lower back. So this is the lower back here. This is a normal curve, an inward curve here. If you have more of a flattened lower back and you've got loss in motion in this direction, when you use a lumbar roll, which is typically placed in this lower back area, this is kind of your waistline, this is your lower back. When you place the roll here, it actually puts too much of a correction. If you don't have enough moved motion in the lower back, it actually may make it feel worse and create more pain in your lower back. So as you scoot back in the seat here, this is how I normally tell people to put it. Get back all the way, buttock against here, and we'll put the roll right above the waistline and have the person lean into it. It should feel good. If correcting that seated posture makes it feel worse, depending on the person, we may need a smaller roll, okay? It kind of reminds me of an old story of a guy that I used to work for. What's the best bike seat? And he goes, the one that fits your ass. So you got to make sure that the roll fits your back, okay? So consider that. You may need a more slender roll. Like we have someone that, my wife's very short. She probably needs a roll that's half this size to fit her back. Also, if you have loss of motion because you have a back problem, disc problem, degenerative disc, you may need to regain that motion for it to make it feel better. So don't just force yourself to use these rolls if they're not working. It's not like we got to work it in, okay? We have to basically make sure the roll fits our back. So consider that if you're struggling with posture and making that linkage. Next thing we're going to talk about is using a neck pillow for a neck roll for our pillows when we sleep. Okay, in regards to a pillow, sometimes we recommend these pillows, these McKenzie cervical pillows, and we'll have people put it in the base of a pillow. So when you're lying down, it supports that natural curve to the neck, okay? Or we'll do it in side lying like this. Okay, it just supports a little inward curvature there, all right, which is a normal curve. So if you have someone that lacks that motion and they have tightness in this position, sometimes that curve that pushing into will actually be more uncomfortable and they can't tolerate this correction to the roll. In fact, they have to regain the motion as far as their neck range of motion before they really can use a pillow. They actually need something that's a little bit higher. Sometimes they need two pillows to accommodate the fact that they don't have adequate range of motion. All right, so it's just something to consider when we're trying to force that and we're saying use these neck rolls. You know, you'll say, wow, the neck roll isn't working. Okay, now it is. It could be the fact that as you're regaining the range of motion, you're actually feeling better as far as the support for your neck because you have enough motion. If you're at the very end range, I'll give an example with a finger. You take your finger and you push something at the very end of your available range of motion. That over time will become bothersome. It'll be too much strain, especially when you're talking about sleeping 6 to 8 hours a night. So if you're at the very end of your range of motion and you don't have adequate range of motion, these corrections as far as posture, sleeping posture, sitting posture, that will actually make things worse. Hey, I hope this helps you out. Hopefully a little less frustration trying to correct posture. Posture and pain and that interconnection is always a topic that we debate a lot here in the clinic. I hope this gives you sheds a little light on making those corrections. Have a great day.